Hi, I'm Christine Greves, and I'm an OB-GYN at Orlando Health's Winnie Palmer Hospital. Welcome to Taboo Topics. Today, we're going to be talking about the taboo topic of the postpartum period, meaning the time after you've had a baby. Your body's going to adjust and try to get back to its normal self. It's not immediate, though. I had actually patients say, am I going to be able to wear the clothes I wore before I was even pregnant? And I said, well, it actually takes some time for your uterus to get back to its normal, smaller state when it did not have a sweet little angel in there. It is normal to gain weight. It is normal to gain, like if you start off with a normal weight, it's normal to gain 25 to 35 pounds. If you lost some blood during the delivery, you may notice some weakness. You may be told to take iron. If you have a history of depression at all, whether it's a history of postpartum depression, meaning if you had some depression in your previous pregnancy, or if you have a history of depression or anxiety, that can sometimes be exacerbated when you're pregnant, and it even results in a postpartum depression. It's a chemical imbalance, and you need to talk to us about that sooner than later so we can help with that. You should also expect bleeding, actually, after your baby's born. Up to the first 6 weeks, you can experience what we call LOCHIA, and that's just a dark reddish type of bleeding. If it's super heavy, that's when you need to make a phone call in case there's anything else inside. Your period may not start immediately and be every 28 days after your baby's born. It takes some time for your body to go through that adjustment. Also, depending on your body's tissue, depending on your delivery, depending on your activity, you may or may not experience some incontinence after having a baby. You may notice some leaking of urine coming, or even gas, like some people experience that type of incontinence. And if that happens, you can mention it to us, and there are certain exercises you can try. So don't feel like you're the only one who has these happening to you. If you had a C-section, you'll have a scar. I had a C-section. I have a scar, and I can't wear certain pants that push on the scar because it's tender. Ultimately, your period would most likely return to normal. When you can expect to have intercourse again depends on the type of repair that you had, if you had a vaginal delivery or a C-section. Generally, though, it's after the 6-week visit, after we do our exam and assess whether it looks like your vagina has healed. As far as getting pregnant and when your period could start, it depends on whether you're breastfeeding or not. Okay, because breastfeeding can actually help cause, can try to help prevent ovulation from occurring. It's all a hormonal feedback cycle, but because it can do that, then that can help prevent pregnancy. And I still don't recommend relying only on that. If you're bleeding very heavily, okay, if you're bleeding more than normal, if you feel weak, if you feel dizzy, if you feel that certain areas are more tender than they were earlier, for example, with regards to your breast, if you feel that they're very swollen, one breast is more uncomfortable than the other, you're having a fever. Anytime you have a fever, please let us know, in case it could be mastitis, meaning an infection in your breast, or if it could be an infection in your uterus or your vaginal repair. But if you notice an odor, if you notice pain and it's not getting better, if you just notice you're not well, you're not right, you're not improving, call us. During this postpartum period, we may feel a little lonely because we're at home taking care of your sweet little angel, exhausted. If you find yourself lonely, reach out to someone that you trust. If you don't want to talk about it and to anyone, talk to your doctor about it. It's all very private. We've experienced this. This is very common, actually. Know that you're not alone, and there are a lot of changes in your body, changes in the way you feel that you may and will encounter. Reach out if there are any questions, because that's what your OB-GYN is here for. We trained for this. This is what we do, and we love it. So congrats. Thank you so much for watching this postpartum period taboo topic discussion.